Hi, my name is Linda Okafor, and in this week 8 journal, we are exploring cognitive behavioral therapy, CBT, and dialectical behavioral therapy, DBT, in clinical practice. Cognitive behavioral therapy, CBT, is a widely used therapeutic approach that focuses on identifying and modifying dysfunctional thought patterns and behaviors. In the case study, the therapist first gave Jill cognitive worksheets to begin self monitoring events. This is to sensitize her to the thoughts and feelings she was having about the events that occurred in Iraq. Then the therapist provided education about different types of thinking errors that could mitigate progress. The therapist also utilized Socratic questioning to restructure Jill's thought patterns. This involved challenging and replacing irrational and negative thoughts with more balanced and realistic ones. Techniques such as thought monitoring, where clients track their thoughts and associated emotions, and cognitive restructuring exercises, where clients actively challenge and reframe their negative thoughts, were employed in this case study. As a psychiatric mental health provider, integrating CBT into clinical practice can be highly beneficial in helping clients address a wide range of mental health concerns. To implement CBT effectively, I will undergo training in this approach and familiarize myself with its core principles and techniques. Some steps to integrate CBT into clinical practice may include conducting thorough assessment to identify clients presenting problems, dysfunctional thought patterns, and maladaptive behavior that may be targeted in treatment. Number two, collaborating with clients to establish treatment goals that are specific, measurable, achievable, relevant, and time-bound. Number three, providing clients with information about the cognitive behavioral model and how thoughts, emotions, and behaviors are interconnected. Number four, teaching clients specific CBT techniques such as cognitive restructuring, behavioral activation, problem solving skills, and relaxation techniques. Number five, assigning homework exercises to reinforce learning and practice skill outside of therapy sections. And last is regularly monitoring patients' progress towards their treatment goals and adjusting interventions as needed. DBT is a specialized form of CBT that was originally developed to treat individuals with borderline personality disorder. However, research has shown that DBT can be effective in treating other mental health conditions such as mood disorders, anxiety disorders, eating disorders, substance use disorders, PTSD, and self-harm behaviors. DBT incorporates elements of mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness skill training, making it particularly well suited for individuals struggling with emotion dysregulation and difficulties in interpersonal relationships. In my current clinical encounter, I have utilized CBT techniques in sections with clients presenting with a variety of mental health concerns. For example, I've worked with a client experiencing symptoms of depression and anxiety to identify and challenge negative thought patterns contributing to their distress. Additionally, I have incorporated behavioral activation strategy to help clients increase engagement in meaningful activities and improve their mood. During a recent CBT section with a client struggling with social anxiety, we focused on identifying and challenging automatic negative thoughts related to social situations. The client described feeling anxious and self-conscious in social settings. often anticipating negative outcomes and fearing rejection or embarrassment. Together, we worked to identify specific cognitive distortions, such as catastrophizing and mind reading, and explore alternatives, more balanced interpretation of social interactions. Through cognitive restructuring exercises, the client learned to challenge her irrational beliefs and develop more realistic and adaptive way of thinking about social situations. We also discussed behavioral experiments to test the accuracy of their beliefs and gradually expose them to feared social situations in a systematic manner. Overall, the client reported feeling empowered and more confident in their ability to manage social anxiety symptoms following this section. They expressed gratitude for learning practical tools to challenge negative thought patterns and cope effectively with social challenges. In conclusion, integrating CBT and DBT techniques into clinical practice can enhance the therapeutic process and promote positive outcomes for clients with various mental health concerns. Continued self-reflection and exploration of my emotional intelligence are essential for effectively implementing these approaches and fostering personal and professional growth as a psychiatric mental health provider. Thank you.